All right, so we're going to start doing the pellet procedure. So you always want to make sure that you have your pellets. So I normally start with like 150. You have your skin pen or pencil. And so that's going to be where you make your markers on the patient's body as your guide. Then you also have your lidocaine for your numbing. So I like to use 1% lido. Some people get it with epi, but I have the regular 1%. Make sure you have some alcohol pads to help clean before you inject. You have some gauze for your bandage. And then also you have your pellet kit. So for females, you're going to want the 3.2. So make sure you have the right one. All right. So you're going to open up your kit. You can keep it as a sterile procedure, but it can also be just a regular clean procedure. And so you're going to have your sterile gloves here. You have your drawing needle for your lidocaine. They give you some alcohol pads, some iodine swabs. Always ask your patient if they have any allergies to iodine or shellfish, just because they can have a reaction if they are. If they do, just use regular chlorhexidine and that'll help out. Then you have your draping, so you can kind of cover the skin, make sure you're protecting the clothing. And then you have your 4x4s, your scalpel, your tweezers for your pellets. You have your tegaderm for your coverage. And then you have the packing for your trocar. So you can put that in there to pack the pellets. And then you also have the actual trocar itself with the pointy part, which will be what goes into the incision site. So you'll see that once I start. So you also have your steri strips for your skin pull. And these are the pellets, so I like to have everything set up before I start. So just be real careful because these can pop out really easy. So like I said, this one's going to be 150 milligrams. And so you always want to look for like their initial dose would be based off of their weight. And so that'll be part of that protocol that I put in there. Your patient right on the edge of the bed, and with their top leg, you want them to cock it up like they're sleeping, and then you want them to rotate their hips forward towards the bed. And then you'll bring their pants down just for the top part of their butt cheek, and so you can see there, and so you can kind of roll their pants down and kind of give some resistance there. And so you kind of want to squeeze. So you want to go ahead and squeeze the area that you want to go towards. Make sure it's a good fatty area. So it's not going straight into a muscle. And you want to avoid that sciatic nerve. So you want to come more so in the upper hip area. Make sure it's a good area. And then you want to make sure that it lines up to the knee. All right. So we're going to go ahead and mark her so we have a good guide of where we're going. So like I said, find your sweet spot there. I like to make little outside lines there, and then a line of where I'm going to put the needle. And so just going straight down towards the knee. That's just a good guide that I normally use for myself. And you have your lidocaine. You can clean the top, make sure everything's clean. I always ask the patient if they have any Irish in them. Sometimes they need a little bit more to numb up. So I usually draw up about 8 to 9 depending on what I may need. All right, so you already know bevel up, and you're going to go into where that incision site is. So you're going to tell them to take a big deep breath in, and then you put in, and slowly out. And then this is where you kind of start slowly injecting a little bit by a little, probably about 0.1 to 2 mLs each area. You'll see a little bubble coming in. I like to do a little staggered motion. So kind of do the first layer superficial, and then when you come out, go about 15 degrees and go a little bit deeper, and then just kind of repeat just to make sure that they have good numbing. So it's going to be a little burning sensation. So some people have that burning sensation. Just let them know, make sure they breathe. And then I like to massage the area so that the lidocaine can spread out. So when you do the different layers of numbing, you kind of numb a little bit superficial and also a little bit deeper in case you go deeper. And it should take probably about 30 seconds to a minute for them to pretty much numb up. And I like to use the needle just to kind of check if they feel any pokes. Do you feel any pokes? No? So yeah, I just kind of go all the way up and down from where I inserted the needle and about down my line there. And so as long as they're good, you're ready to start. And then we get our drape. So this is just to help protect their clothing and to kind of give you a field to work in. So there's 3 sticks in here, so you can use all of them. So inside to outside. And you just repeat it again, making sure that it's nice and clean. Kind of want to make sure your guideline is there. So I see mine coming from the top there. So you get your scalpel and you want the blade down. And so I like to just go straight down and out. So straight down and out. And that's all you need to do. So the incision is very small. And so you don't need to cut and slice. It's just a straight in and out. Then you're going to get your trocar with the pointy part like that. Make sure your chamber is open. So you have an open chamber there. So just make sure that's to the top. And then you want to go straight down and then pivot up. So you're going to see your chamber kind of fill up there. And you just twist, twist, twist. And then it should go on. You feeling okay? Mm-hmm. All right. All right. And so there. And you take your trocar out. All right, so you have your trocar in place like that. And then I like to bring over the entire tray. So for me, I like to put the bigger pellet in first. So I like to put the bigger pellet in first. So if any reason, if say the pellets push out, the smaller pellet would come out first instead of the bigger one. So you kind of push it in there like that. Pulls. And then you'll grab the flat end to pack the pellets in. So you put it in the chamber and you'll pack it in a couple times like that. Then you get your gauze and you put it on top like that to catch any blood. And then you're able to remove your dressing. And then you're gonna get your steri strips. You're gonna take the backing off like that. So I like to just put it on the back of my hand so it sticks there and I can move with one hand. And so just want to clean up a little bit there. And then you squeeze and you apply your steri strips.
I want to clean that line, clean scar.
So that helps pull the skin together. So like she said, it gives you a nice, clean, even skin pullback. And so I like to just do like a little star. And so just make an X. And then you just keep going. And you just want to make sure that you have that resistance. If you have any blood coming out, you just want to make sure it's dry. So you just put a little star dressing like that. And that's how you put in a pellet.